Good morning, everybody. Just to start, I have some questions to ask you. I wanted to know how many of you actually have done meditation session or fitness session this morning? Any of you? Great. I've taken a breakfast. That's good. Okay, my name is Fabrice Pakin. I am the CEO and the founder of Ignilife. When we start the company, our mission is to help people taking care of their health for good. And why? Because the lifestyle habits, bad lifestyle habits, and chronic disease are spreading all over the world today. And this has very huge consequences in terms of health costs, but also in terms of absenteeism inside the companies. But there is a solution about it. And prevention today for us it's much better to invest in prevention than investing in cure. 66% of chronic disease, you certainly already know those figures, are actually avoidable by your lifestyles. 67% of health determinants can be modified. So if you can action it yourself, actually, to feel good. And the market today is much more mature and ready for prevention. Many governments, the last one was the French government, is taking seriously prevention and making prevention a #1 priority. The people also are much more aware about their health and about their lifestyles, and the companies also are much more aware of the health quality of their employees. And this is good actually because we have developed a full ecosystem around prevention, creating value for all stakeholders. First, the Ignilife coaching application, it's a web or mobile application where the user can actually assess its health, he can set his goals, reach the goals with the help of its personal care team composed of nutritionists, personal trainers, nurses, and psychologists. Those coaches have actually their own platform, so they are able to monitor their population. We also create value for the payers. We have created a set of tools inside Ignilife dashboards so the payers can easily enroll its population, get access to insight and analytics in real time so he can understand exactly what's the picture of its population. He also is able to act in a very easy way because we connect the payer actually to a marketplace where we integrate the best services and products available in the market so it can actually push the right benefits to the right person among its population. We also create a lot of opportunities for the coaches, actually, and certified coaches. They can join the platform and be able to coach our population. The platform today is in 6 languages, in French, in English, in Portuguese of Brazil, Spanish, Dutch, and in German. It's a very scalable, affordable, and data-driven platform. We create outcomes, actually. We have very good figures. For example, on the onboarding, 93% of the person feel actually the health risk assessment. So really, we get a lot of data. 61% of our eligible population, when we start in a company, enroll or engage or install the application after a week. We do a lot of customer success management with our customers to get those figures. And 52% of our users say they actually change one or several habits after 3 months of use of the application. So today our main customers are insurance companies and medium and large corporations. And we know we are starting to work also with health providers, especially in Switzerland and also in Brazil. And we have now a lot of town halls, city hall, especially smart city, wanted to develop a culture of health for the population, starting to see us actually, to see how we can involve them with our application. The B2B model, it's a B2B2C business model. So we make money a lot with licenses, but also with cross-sellings, services, and coaching revenues. So it's a multi-side business model. So where we are now, the headquarters is based in France. We have also a branch in Switzerland, in Geneva, a distribution agreement for Benelux, and we opened at the end of the year 2018 a branch in São Paulo, Brazil. And we have customers in all those countries today, especially a big insurance company, but also corporates and recently a health provider. In 2019, we sold 650,000 licenses, $1 million revenue, and an average MRR of 80,000. Where we want to go for the next years, we want to scale our sales. We need to consolidate our position. We want also to open new markets, especially in Europe and emerging countries. We also want to be more future ready. So we want to transform our coaching application in a more conversational way, mixing IH, IBAT, and human interaction. This is better for better scale and better experience. But also, we would like to also enter with vertical programs, especially in digital therapy. And we work now for a year in research and development for an IA in depression and anxiety. So going also in the market to solve the biggest problem, which is the people actually with chronic disease or high risk. So we are today starting a Series A funding. We are looking for $4.5 million. So if you want actually to help us, you want to be part of the change, this is my email, and we can keep in touch anytime, and I will be available for you. Thank you for your attention.